My name is Priyanka, second year postgraduate. Now I am going to tell a series of cases regarding the correlation of retinal nerve fiber layer thickness with visual field defects in patients with primary open angle glaucoma. My aim is to study the correlation of the retinal nerve fiber layer thickness with that of the visual fields in patients with primary open angle glaucoma. Inclusion and exclusion criteria. Inclusions, we have included all the cases of primary open angle glaucoma, and exclusions, we have excluded the patients with media opacity, history of retinal diseases including a diabetic, hypertensive or CKD, and best corrected visual acuity worse than 6/24, and history of any eye trauma or surgery, and neurological field defects that affect the visual fields, and unreliable visual fields and poor OCT images. And we have also excluded the angle closure glaucoma and congenital glaucomas. Materials and methods. 50 patients attending the ophthalmology OPD NRHGH Chinnakakani with primary open angle glaucoma were included in this study. Institutional ethical clearance and the informed consent was taken. It is a prospective type of study, and detailed history and ocular examination was done, and history regarding the family history of glaucoma is also taken, and visual acuity regarding the is done with the Snellen's chart, and anterior segment examination with slit lamp biomicroscopy, and IOP was done by applanation tonometer, and angle by gonioscopy, and posterior segment we have done either with direct ophthalmoscopy or indirect ophthalmoscopy or with slit lamp biomicroscopy with 90D lens, and a standard automated perimetry, that is Humphrey static perimetry of 30-2 was performed in all the cases to detect the visual field defects, and SDOCT, that is spectral domain OCT, was done for measuring the retinal nerve fiber layer thickness. Age distribution, most of the patients lies between 18 to 73 years, and maximum of which lies between 40 to 50 years, that is 12 patients. And gender distribution, out of 50 patients, 32 are females and 18 are males. Family history, there is a 10 cases showing a family history of known cases of glaucoma, that is 20%, of which 6 are females and 4 are males. Baseline IOP measurement, maximum ranges between 10 to 20 mmHg, that is 60%, followed by 20 to 30 mmHg and followed by 30 mmHg. Visual field defects, normal is 8%, and paracentral scotoma is seen in 60%, arcuate scotoma in 12%, and double arcuate in 2%, and tubular vision in 2%, and general reduction in sensitivity in 16%. RNFL defects, normal is seen in 22%, and superior defects we have seen maximum, of which they are 24%, inferior defects are 18%, and superior and inferior defects are 20%, superior and temporal are 7%, inferior and temporal are 3%, and least is the temporal defect, that is 1%, and combined defect of superior, inferior or temporal we have seen are 5%. Out of the 50 cases, 40 cases we have seen the correlation, that is 80%. Out of 5 cases with superior arcuate visual field defects, there shows an inferior RNFL defect, and out of 9 cases with inferior arcuate defect, there shows a superior quadrant defect, and out of 2 cases with double arcuate in the visual field shows inferior RNFL defect, and out of 1 case with the tubular vision in the visual field defects shows either both superior, inferior and temporal defects. In 23 cases with the visual field defects of paracentral scotoma, there may be either superior, inferior or temporal defects. This is the image showing a visual field and a OCT of the same patient with the same eye, and in the visual fields we can see there is absolutely normal, and in case of the OCT we can see a inferior quadrant defect. And this is the image showing a visual field and OCT of the same patient with the same eye, which is showing a paracentral scotomas in case of a visual fields, and in case of a OCT it is showing superior defect. And this is the image of patient with the same eye and same patient with showing a arcuate defect in the visual fields, and in case of a OCT we can see a superior and a nasal defect. This is the image showing a visual field of the patient showing a tubular vision, and in case of an OCT we can see both the superior and the inferior defects. Discussion. In our study, the highest RNFL defect is seen in inferior quadrant followed by superior, nasal and temporal quadrants. Similar results were found by the Bird et al. Subba et al., while analyzing the results, glaucoma patients, glaucoma suspect and of normal subjects using OCT, found that RNFL thickness was greatest in superior and inferior quadrants, which is also seen in our study. Conclusion. Retinal nerve fiber layer abnormalities can be detected by the optical coherence tomography, and it is compared with the visual field defects, which helps in the early diagnosis of glaucoma, even before the onset of structural damage. Early detection by the OCT helps to prevent the permanent vision loss by the visual fields before the visual is as defected, as 40% of the nerve fiber damage has already occurred. These are my references. Thank you.
What are the reliability indices which you have taken to take your visual fields in the study? Is it mentioned in your presentation?
No, madam, but I have taken the fixation losses, any false positives or false negatives. I have included those. As in the exclusion criteria, I have excluded the unreliable visual fields.
What do you mean by unreliable visual fields?
Whether there is any fixation loss, if it is more than 20%, we have excluded it. False positives and false negatives more than 33%, we have excluded it. And visual field index, we have excluded if it is not 100%.
What?
Visual field index.
Visual field index not 100. In any glaucoma patient, visual field index will not be 100%.
Sorry, ma'am.
What do you mean by poor OCT? You said you excluded poor OCT image. What do you mean by that?
While doing the OCT with the media opacities.
So what is the parameter?
Signal strength also.
Have you mentioned below what signal strength you have excluded your OCT?
No, madam, I haven't.
So do you think it is important in such a study where you have not mentioned the exclusion criteria? You cannot take all 100 visual fields you have done into study. There will be some. And have you taken the first field? Is there any learning curve? Was the field repeated?
Yes, ma'am. The fields are repeated. If the patients are not cooperative or if the patients cannot do, we have repeated the fields, and we also have repeated the OCT images also if there is any signal strength less.
So all that should have come up in your methodology.
Yes.
Why did you include visual acuity less than 6/24 in your inclusion criteria? Do you think that is important?
Yes, ma'am.
Explain.
Because in case of an in case of a glaucoma, even the patient may have a 6/6 of vision, tubular vision. Patient may have a tubular vision, but patient's visual acuity is 6/6, and patient does not think that he has any damage. So I have included those less than 6/24.
Okay. And can you see the disc clearly with indirect ophthalmoscopy? Can you make out the disc changes with indirect ophthalmoscopy?
Not completely, madam. I have used either direct or indirect, or I have used a slit lamp with 90D. Everything I have tried.
Okay.
Thank you.